My patient today is a 24-year-old female equestrian athlete, and last night she fell off her horse onto her outstretched arm, her right arm, and she felt immediate sharp pain in her kind of anterior top of her shoulder. The pain was immediate, like it happened right away. She describes it as about an 8 out of 10. The only thing that makes it better is to immobilize the shoulder. And what makes it worse is any kind of movement or anything, any use of the shoulder. She did kind of hear and feel a bit of a popping sensation at the time of the accident at her shoulder. And the other signs and symptoms that she has are weakness and a lot of instability in the shoulder. And she does not have any previous injuries to her upper body, and she's on no medications and doesn't have any allergies. I observed her shoulders bilaterally, and her right shoulder is sitting a little bit lower than her left, and they're both internally rotated a little bit, as well as there's some bruising and swelling on her anterior right shoulder, and the distal end of her right clavicle is visible when it normally shouldn't be, and there's a bit of a gap between her clavicle and her acromion process. I'm just gonna do some palpations now. Can I get you to turn a little bit? I'm gonna start with the spine of the scapula. And there was no pain there, and I'm going to do her posterior rotator cuff muscles, starting with the teres minor. And the supraspinatus. And the infraspinatus. And there was no pain with those. Can I get you to turn a little bit? And now I'm going to palpate her clavicle. And there was some pain with that, as well as I'm going to palpate the acromion process. And that one was pretty painful as well. Now we're going to start functional testing. We're going to start with active range of motion. Can I get you to put your elbows by your sides, and then bring your hands apart and together? And then can I get you to turn around? Put your left hand behind your back. Doesn't matter, and then reach up. Good. And then your right. Good. And then turn around again. And then do both arms above your head. Does it this way? Yep. Above your head. And then down, but keep going. Good. And then both arms up out to the side. All the way. Good. Then keep going. Yep. And then back down. Good. And then arms halfway up again. And then bring your hands together. Good. And then back out. And down. Good. Now I'm going to walk you through that on both sides. So, passive. This is passive range of motion. Good. Now I'll do the other side. Good. So the right arm with all of those was definitely a lot more limited and definitely a lot more painful, both active and passive. So now we're going to do resisted range of motion. Okay, so can I push against my hands? Good. And then push this way. Good. And then arms by your sides. And then try and raise your arms. Good. And try and lower them. Good. And then bring your arms straight forward to me. Good. And then lower them. Good. And then bring your arms halfway up. And then turn your palms together. Good. You did this one right?
I think so.
Okay, good.
Oh, straight out is what
Yes.
you meant. Okay.
Yeah. Good. For the resisted range of motion, her right side was noticeably weaker than her left with most of the movements. Now we're going to move on to some special tests. So the first one is the piano key test, which tests for acromioclavicular ligament tear or sprain. It's where you push down on the distal end of the clavicle, and if it bounces like a piano key, then it's positive. So, and there was a lot of movement there, so it's definitely positive. And the second special test is called the empty can test, and it is for a supraspinatus strain or rupture. I'm going to have you put your arm out at about 45 degrees from your body, and then you're going to try and resist me when I push down. Good. And that one was clearly negative.